Hi everyone, good afternoon. I am Pearl Shiloh Bartolome,
And I am Adrian Abanes.
and today we're gonna present to you the analysis of surgical options for patients with bilateral carpal tunnel syndrome.
Next slide, please. And here are the contents. First, number one, the background. This includes the background of the study, when it is published, and the authors. Number two, introduction. It includes the objectives and main purpose of the study. Number three, methodology. It shows the process done on the study. And number four, results. The findings and the result of the study were clearly elaborated. And last, number five, conclusion. It emphasized the results of the gathered data.
Okay, so for the first content of this presentation is the background. So as you can see, we specifically chose this study because it is systematically reviewed by the authors. The authors are all expert in this field. Next is introduction.
Introduction. Bilateral endoscopic carpal tunnel release is a modality offered for the treatment of the median nerve compression neuropathy. This retrospective study compares outcomes for patients undergoing open carpal tunnel release versus bilateral endoscopic carpal tunnel release. We hypothesize that there is no significant difference in post-operative complication rates between unilateral, open, and bilateral endoscopic carpal tunnel release surgery, as defined by the American Academy of Orthopedic Surgeons, or the AAOS. Carpal tunnel syndrome, which is the CTS, is a symptomatic compression neuropathy of the median nerve at the level of the wrist. Clinically, CTS is characterized by numbness or pain, paresthesias, weakness, and decreased function distributed along the sensory digital nerves in the affected hand. Current treatment options include non-surgical modalities such as splinting, physical therapy, oral steroids, and steroid injections. When such methods fail to alleviate symptoms within 2 to 7 weeks, surgical decompression of the median nerve is a well-documented procedure that is recommended by the American Academy of Orthopedic Surgeons. The purpose of this retrospective chart review is to compare outcome measures between bilateral endoscopic, or the BECTR, unilateral endoscopic, or the ECTR, and sequential open carpal tunnel release, or the OCTR.
For the methodology, the authors identified all patients who underwent open carpal tunnel release, unilateral endoscopic carpal tunnel release, and bilateral endoscopic carpal tunnel release at the university hospital from 2012 to 2014. Cases were identified using CPT billing codes, and the data was assessed using an analysis of variance, or also called as ANOVA. All endoscopic carpal tunnel release were done by the same surgeon, and greater than 90% of the open procedures were done by a different same surgeon. Okay, so the operative variables recorded were first, tourniquet time; second, incision to close time; third, the motor branch nerve injury defined by weakness of the tenor muscles; fourth, post-operative hand numbness that did not improve with surgery; 5. Wound infection; 6. Hematoma assessed on physical exam in the clinic; 7. Post-operative pillar pain; 8. Number of follow-up appointments during a 3-month post-operative period; and 9. Recurrence of CTS; and lastly, need for hand therapy. So the data was analyzed using descriptive statistics and graphs. Specifically, the data was assessed using an analysis of variance, or ANOVA. The level of significance was set at p less than 0.05. The results were then used to offer a statistical comparison of the outcome variables of both surgical procedures.
Next is results and discussion. The total combined complication rate was 24.7% with no significant difference between techniques. There were no major complications necessitating a return to the operating room. Variables that had a statistically significant difference between groups included mean tourniquet time, mean total procedure time, and return to work as determined from the number of follow-up appointments.
Lastly, for the conclusion, the study demonstrates equivocal complication profiles and decreased costs associated with bilateral endoscopic tunnel release as compared to sequential open carpal tunnel release. We believe that the option of endoscopic bilateral CTR for patients with bilateral CTS offers a safe and effective alternative to open carpal tunnel release. Additionally, this option may reduce the stresses and costs of multiple surgeries without compromising patient care or safety. Therefore, orthopedic and plastic hand surgeons should strongly consider offering the option of bilateral endoscopic carpal tunnel release to patients with bilateral CTS. Again, I
And
am
that concludes our presentation. And I am again Adrian Abanes and joined with
Pearl Bartolome. Thank you for listening.
thank you.